Hello, I'm Dr. Sophie Bakri, a retina specialist at the Mayo Clinic and a member of the American Society of Retina Specialists, also known as the ASRS. The ASRS is the largest organization of retina specialists in the United States. Retina specialists are medical doctors who have completed a residency in ophthalmology involving training in the medical and surgical treatment of eye diseases. We specialize in treatment of the retina, the light-sensitive tissue which lines the back of the eye. Today, I'd like to tell you about an exciting new patient education campaign from ASRS called Retina 2020. We hope our campaign will help reduce much of the visual impairments which otherwise can occur from untreated age-related macular degeneration and diabetic retinopathy. These are two leading causes of blindness in the United States and throughout much of the rest of the world. Retina 2020 is designed to support the goals of Healthy People 2020, a program of the U.S. Department of Health and Human Services aimed at improving the overall health of Americans. Why should patients care about macular degeneration and diabetic retinopathy? The short answer is that these two diseases are major public health problems in the United States. While these conditions can take away one's ability to read, drive, or recognize the faces of our friends and family, they often can be detected and treated before substantial vision loss has occurred. One of the goals of Retina 2020 is to provide the most up-to-date information on how people can maximize their chances of avoiding blindness from these common retina problems. As our society ages, the number of Americans with macular degeneration is increasing. The risk of getting early or advanced stages of this disease increases from 2% for those between the ages of 50 and 59 to nearly 30% for those over the age of 75. Left untreated, age-related macular degeneration could account for over 50% of all blindness in people over the age of 50 in the United States. While diabetic retinopathy may be less known by most Americans, it too is a serious and growing public health concern. Diabetic retinopathy affects 5% of people 75 and over, but it also impacts young adults. In fact, 1 in every 12 people over the age of 40 with diabetes has visual impairment due to diabetic retinopathy. About half of these people develop damage to their retina, but if detected early, in conjunction with good medical control of diabetes, most vision loss can be prevented by treatments available to a retina specialist. As co-chair of the Retina 2020 campaign, I'm here to urge you to help us do something about these growing common health issues. Unless we take action now, by 2020, we are expecting that more than 50 million Americans will be blind or have substantially impaired vision as a result of these and other conditions, such as glaucoma and cataracts. The good news is that we can take action. Today, patients have more treatments than ever before to slow the progression of these diseases and to save sight. But first, we have to detect who has vision loss from these conditions or has earlier stages of these conditions before vision loss has occurred. Retina specialists are the nation's experts in having the ability, training, and experience to treat all medical and surgical aspects of these diseases. As the organization representing them, the ASRS is doing all it can to help patients learn more about the prevention, diagnosis, and treatments of macular degeneration and diabetic retinopathy. We are also promoting research to find new treatments and are actively disseminating information about clinical breakthroughs that will improve the lives of our patients at risk of vision loss from these diseases. We would like you to be a part of our Retina 2020 campaign, which is working with patient groups, healthcare organizations, and the National Eye Institute of the National Institutes of Health to promote early detection and treatment. Visit our website, asrs.org, to learn more about our campaign. Together, we can reduce visual impairment and blindness. Thank you.